Good afternoon, everybody, and welcome to our most recent briefing. The sun is shining and we've got good news. We're moving in the right direction at last, but it's still at last. I mean, it's been incredibly difficult, hasn't it? Parents haven't been able to, well, grandparents have not been able to hug their grandchildren. I was watching something on Newsnight last night about university students over the last 18 months. Unlike when I went for my tertiary education, you went for the lifetime experience. A lot of them are doing it from home. It's not the experience they wanted. Kids are having their education affected. People's lives have been made very difficult indeed. There's been considerable restriction on civil liberties. Everybody regrets that, and everybody empathises with that. The difficulty and the loneliness some people feel, and everybody suffered, whether they're old, middle-aged or young, and some people suffered more than others. Our empathy is with you. I mean, it really is awful, but we've got to move out of it. Now, we can only move out of it, as I ever say, and I don't mean to be boring, but I'm going to repeat it, if we are vigilant. We've made good progress. We're in our third day in Guernsey in stage 1. We want to move as quickly as we reasonably can to stage 2, but we can only do that if people do what they're supposed to do. People on building sites work away from each other. Delivery drivers, I know no delivery driver will ever deliver anything to my house again, but if they wear their masks, if they put their gloves on, and they do. Now, what we can say in relation to our good friends in SARC is that although we will have to go through all of these stages, the decision has been made in relation to SARC that SARC will move forward to stage 2 tomorrow. So that's Thursday, the 25th of February. SARC will move into the next phase, because don't forget, SARC has got these very strict border controls between Guernsey and SARC. And all things being equal, SARC will then move a week thereafter. So that will be the 4th of March, Thursday, the 4th of March, from stage 2 to stage 3. As I say, that is conditional on things going well in that week, but I'm sure that they will, or I'm as sure as you can be that they will. Now, also the difficulty, there are some businesses that can't operate. We're now under stage 1, some businesses that can, and even those that can have restrictions. We apologise for those, but they are necessary. And we ask people, as they are overwhelmingly doing, to continue to restrict those. But for those that are not following the guidelines, please stop, because you are endangering the good progress that we're making. And of course, we still had one community source case the day before, yesterday, whatever it was, and we've got to make sure that those are looked at and that they are under control before we can move forward. Now, we've already posted the business media releases in connection with what P&R have decided, Policy and Resources decided. One of those is that the businesses that are most affected will be able to claim payroll co-funding for another month. And the second is that the visitor accommodation will have that bespoke assistance that was given to them extended again where needed for another year, so that those are there to give people certainty in what are difficult times. Now, we've been asked about what about border openings, etc., etc. That is too early yet. We will be considering that as soon as we can, but at the moment the current restrictions will pertain. If we can change them sooner rather than later, we'll do that. Now, I don't think you need anything more said from me, because my colleagues, beginning with Dr. Brink, and then the Chief Executive, and then Deputy Bride, will deal with various aspects of the lockdown. So I'm going to hand straight over now to Dr. Brink.
So thank you very much, Deputy Fairbright, and I'm going to do my usual update, but perhaps focus on some specific queries that we've had. So overall, if we look at slide 1, our case summary was we have 508 total cases in the second wave, but very encouragingly, we now only have 37 active cases as of yesterday, and as of noon today, we're down to 31 active cases. So really progressing well. Of course, we always regret the death we had, but it's encouraging to note that 470 people have recovered. So I also wanted to focus a little bit on the positive case that we had yesterday. So this was a community case. The person came forward and were tested because they were symptomatic, and we really do appreciate that person coming forward to be tested. They are doing and helping their community. They're working with and helping their community. Now, as ever, we then go and do some contact tracing around the case. So not only do we look at the contacts within the household and any wider contacts that that person may have had, we also go backwards to see if we can try and find out where that person got the infection from. Now, that forms all part of our outbreak management. Now, with this particular case, although we weren't able to say they definitely got it from that person, they were linked to a source where we knew there was COVID activity. Now, sometimes what happens then is you have someone who's positive, they might have had contact with another person who's then resolved the infection, but before they resolved the infection, had contact with a person that then becomes infected and presents symptomatic. All the time we're pushing to see where we can find the source of infection. And this person was linked to an area where we knew there was COVID activity. So I just wanted to highlight that. I also wanted to focus on hospital admissions. We have one hospital admission at present, and so we're down from what we had last week, which of course is also encouraging. But I wanted to stop here and pause and think about the healthcare workers that have worked in full personal protective equipment, full PPE, whilst they were working under very difficult circumstances. And I don't know, some of you might have worked in full PPE, but it's hot, it's uncomfortable, and you really have to use all your resilience to deliver your work in a professional way. And I think that's important. And really, I'm in awe of their quiet professionalism. They've just simply got on with it. So I think a big shout out to all our healthcare workers who've been working in PPE during this difficult time. So if we then go on to the next slide, which is our modelling slide, which I think you all know is one of my favourites, looking at modelling. But what you can then see, and I'm showing you the logarithmic graph today, and what you then see is how we have essentially squashed that curve. So it is encouraging. We need to still be vigilant because we are still seeing cases. But what you see from this graph is the efficacy of the lockdown process. So at the start, we want a doubling trajectory of between 2 and 3 days, probably close to 2 days, so a really steep exponential growth of virus. What you see now as we move out and beyond, and this is a 5-day moving model, you can see how we've squashed that curve. So really important. And just to remind you, this graph is modeled on symptoms, and when we don't have symptoms, we use the date of testing as a proxy. So what that's showing is the efficacy of lockdown has been extremely effective, and we're moving in the right direction. So if we go on to the next slide, which is all about our vaccine statistics, slide 3, it's a compilation of data that I thought everyone might be interested in. First of all, what the graph shows, it shows the percentage of the population over 16 years of age that have had the COVID-19 vaccination, with the maroon showing people who had 2 doses and the blue bars showing 1 dose, those who've had 1 dose and are due for their 2nd dose. So what you can see is that 17% of our population have had 1 dose of the vaccine, and an additional 10% have had 2 doses of the vaccine. So that equates to 27% of our whole population. Importantly, also, if we then translate it to what's being measured nationally and internationally, which is the total doses per 100 population, that equates to 30.5 total doses per 100 population. If we look at numerically, we've now delivered over 20,000 doses of vaccine. So really, this is an extremely impressive amount of vaccine delivered by a very small and dedicated group. And as ever, we're grateful to them. I also thought just to stop and give a highlight as to where we are on the vaccination priority group. We're currently vaccinating priority group 5. Now, not everyone in priority group 5, just to remind you, that's 65 to 69. Not everyone would have actually received their invitation yet, because we're doing it in tranches. We estimate that this group consists of about 4,400 people, so quite a lot. So we're booking people in blocks of 500. So if you are in this group and you haven't received your invitation yet, don't worry, it will be coming. So if I then go on to the final slide, which is the age of the active cases. Now, I really produced this predominantly for our hospital services, but also for primary care, because what it shows is where our clinical risk is. But what you can see from this graph is how effective our vaccination program has been, because we've got very few cases in the over 80s, and we know this is the population group that have mostly been fully vaccinated. So very, very encouraging. The peak age incident is 41 to 50. And we're seeing that it started off in the younger children and has gone up through the other age groups. So I think that's important. As we look at that, it enables us to look at what our risk is, and it's encouraging to see so few cases in the group that is extremely vulnerable. The final thing that I wanted to highlight today was the issue of antenatal scans. And I know this caused a lot of concern for a lot of islanders, and thank you for bearing with us on this. What is happening today, and we've had incredibly positive feedback, so thank you to those who have contacted us, is that partners can come with their pregnant partner to their antenatal scan, and that's been really welcomed. A few people didn't realize that they could bring their partner, and so we're a bit disappointed. And so one said to me, please mention it on the press briefing, partners can come to an antenatal screen. So please, if everyone could spread the word, that would be good. And it remains for me to say thank you so much to everyone for the support we've had over the past weeks. You've no idea how much it's meant to all of us, and we really appreciate it. But that's my update. Thank you, Deputy Fairbrash.
Very much, Rick. Hand over now to our Chief Executive, Paul Whitfield, who's going to talk about stage one and businesses, how it's operating, and where we go from here. Paul. Thank you, Deputy Fairbrash. Since we began the rollout on the online form for business, we have had just under 1,400 businesses notify us of their intention to operate, and in doing so, that can do so within the rules of stage one. Just as a slight aside, because we have the data and thought it might be of interest, we've had more businesses from the construction industry notify than any other, with about 400 so far. Wholesale and retail businesses make about another 200, and the next three sectors with the most businesses notifying of their intention to operate of being agriculture, horticulture, hostelry and finance. But I would again say, for any business that have not yet done so, if you're already operating or intending to operate, you must complete the form. It can be found in the business section of our COVID website, along with all the guidance for the requirements for operating during stage one. And I would again urge all businesses to review the information there is, because it clearly sets out the rules and principles businesses must comply with if they are intending to operate. Our teams from the Office of Environmental Health and Pollution and Regulation and the Guernsey Border Agency have been carrying out spot checks and will continue to visit these premises as needed. I do want to highlight that we have received a small number of reports from members of the community where they believe they have seen businesses or staff not operating in line with the rules. This could be more staff on premises than is allowed or not socially distancing, for example. Now, these won't all be accurate, of course, as they may be a case of misunderstanding, and as stated, we will continue carrying out checks. But as with so many elements of our COVID response, we are reliant on the whole community playing its part, and that includes business. It's not about following the rules for the sake of it. It's about making sure that COVID does not spread in your business, amongst your staff, and then out more widely into the community. If you don't follow the rules, the repercussions could be huge, and that will negatively impact your business as well as the rest of our community, many of whom are understandably struggling at this very challenging time. As Deputy Fairbrash has noted, no one wants to move backwards from this good position we've reached. Just before I hand back to Deputy Fairbrash, I have one more note regarding income support, and it's something I've said before. If you claimed income support or received hardship payments as a result of this lockdown, but have now been able to return to work, please contact the income support team to let them know that your circumstances have changed. You can contact income support by emailing incomesupport@gov.gg or by calling 732 508. Thank you. Thank you very much, Paul. In a minute, just going to hand over in a second, really, over to Deputy Brouard. But as I said before, this is so difficult and has been so difficult for so many people. And life is about people. Life is about people interacting with each other, families, friends, doing all the social things that people like, going to work, operating their businesses. It's been very difficult. Deputy Brouard will take that point up and develop it further.
Thank you very much, Deputy Fairbrush, and good afternoon. I just want to use today's briefing as a chance to speak to those who may feel challenged or alone and may feel that hope in this second lockdown is in short supply. And it really picks up the theme that Deputy Fairbrush opened with this afternoon. This second lockdown for some is harder than the first. The novelty is certainly gone. There are fewer rainbows in the window, and we're all just trying to get through it. For some, it goes much further than that, and it's been a very bleak few weeks for them. We need to remember the reason we locked down, and that's to prevent COVID spreading and getting out of control, which would lead to many people becoming seriously ill or even dying. It's been about protecting lives, but it's more than that. It's also about our health service not being overwhelmed, leaving us unable to deal with a whole range of other urgent health problems. But there is no doubt that the lockdown has its own health impacts, both on our physical and mental health, some of them extremely serious. Health and social care services are seeing them in real time. Our community teams have seen an increasing demand for support. Islanders not being able to get access to respite from on-island care homes who've had to restrict who's coming in, going out. Still down a bit. Some is just down to being stuck in the house. Lockdown also leads to people putting off contacting a GP despite not feeling well, when they should really be getting checked out. Please don't. If something isn't right, call your GP, the same as you would at any other time. They're there to help you. For some islanders, the stress, the loneliness and the sense of isolation has been there for longer than just this lockdown or even the first. It's a year since some have been able to leave the island or seen families overseas and vice versa. Some have missed big moments in families' lives or not been there when loved ones needed us, and also when it came to saying the last goodbye. We've all got stories about how this lockdown has been hard and how it affects us, and the Civil Contingencies Authority is absolutely conscious of how tough a time it can be and what a fine line we walk. I do want to give some helpful contacts. There are a lot of services, both within health and social care and elsewhere, that are there to help when it starts to become all too much. These details are available on our COVID website. I'll just read out a few. Healthy Minds is a service for you to self-refer to, and they can help you find ways to manage, especially if your mental health and well-being is suffering. Call them on 707744. That's 707744, or email healthyminds@gov.gg. Health Connections are also there to help us keep connected and provide support. They're running a Help Your Neighbour campaign, providing leaflets that you can print from their website, healthconnections.gg. That's healthconnections.gg, and pop through your neighbour's letterbox offering help. That may be as simple as offering them a call to have a chat, or if your neighbour you know lives alone or may be struggling, use the leaflet or just pop a note to their door to say that you're there, and it could just make a real huge difference. Guernsey Mind is another wonderful service, providing lots of types of online support groups as well as one-to-one support sessions. There's also St John's Caring Callers. They're available 24/7 to make phone calls and check in on anyone who's on their own or vulnerable or feeling lonely. And if you're on Facebook, there's the Isolation Support Group, which has some 3,000 members. Even if you are the only one in your house or in your bubble, you are not alone. There are a lot of people out there to help, and no one should feel alone, and no one should lose hope. It's still a tough time. It will get better. It's getting better every week. There are more reasons to be hopeful than ever before in this pandemic. The vaccine rollout, the fall in the infection rates in Guernsey, and even the better weather and brighter days. The light is visible at the end of the tunnel. Let's make sure we all get there and we don't leave anyone behind. Thank you.
Thank you very much, Al, for those very good and considerate words. Well said. We're going to go in a moment just to the media, but I'd just like to mention something because drawn to my attention by 2 or 3 sources recently. There was a picture of the panel drawn by a young lady from Beaucamp. Hi, Amelia. She's obviously very talented because she makes Deputy Broad and I in particular look far better than we look in real life. So I'm very grateful to her. In fact, one of my daughters said, Amelia is obviously a very talented young lady, but Dad, she's given you more hair than you really have. So I'm grateful to her for that kind consideration. And I hope that the media are going to be just as kind to us. I'm going to start with the questions now. Juliet from the Guernsey Press, you kick off, please.
Good afternoon, panel.
Good afternoon, Juliet.
I'm very conscious we're only a few days into stage 1, but obviously there is very keen interest on what the process is now into stage 2. I know it is very early, but at what point are you hopeful, or what's the earliest stage you think we might be able to start discussing moving to stage 2 or possibly moving to there?
I'll start with that, then I'll ask Dr. Brigg. We're starting to discuss it. We've got another CCA meeting tomorrow. We'll discuss it then, but as you rightly said, this is only our 3rd day. It's going to be some time before we unravel, but we want to unravel it and move into stage 2 as quickly as possible. Very good question. Dr. Brigg, do you want to add anything?
Thank you. So, I mean, it's the triggers, and the triggers are looking good. We're moving in the right direction. We just need to focus on these odd community cases that we're getting and make sure we understand them, and we can stop any onward transmission from those cases. So really important as we move forward. But all the parameters are looking hopeful. Thank you.
Ewan Duncan, your question, please.
Good afternoon, Ewan Duncan from BBC Guernsey. I'd like to respectfully disagree with you, Deputy Fairbrush, by saying that it is not too early to talk about the borders. We previously talked in press conferences about living with the virus much in the same way we do with flu. And we know that in the UK, Jersey and Guernsey, the rates of vaccination are some of the best in the world, actually, with the most vulnerable in those communities actually being vaccinated or in the process of being vaccinated. If we look at the previous country and regional border classifications, which Guernsey had in place last year, Edinburgh would be in category 2. The whole of Wales, North East Scotland, South West England, which includes Exeter, which is somewhere where Aurigny fly to, would actually be in category 3. So that wouldn't be the 14 days isolation requirement based on last year's system. So my question, after a long time, is when will Guernsey actually move back to this modelling, and what is the criteria that's going to be set out to enable travel to restart without this current permit system?
Well, you're right to gently upbraid me in relation to what I said. Of course, it is under consideration. But what I said is that at the moment, we do not see, we being the Civil Contingency Authority, any quick movement or relaxation of the borders. And you've talked about level 3 here and level 2 there and whatever. The UK then abandoned that very quickly and went back to general categorisation. They are talking about, in relation to their travel movements, staycations for most of 2021. And the states of Guernsey have approved visitor accommodation being used, or self-catering accommodation being used for residential, i.e. non-tourist purposes for the whole of 2021. We just made that decision this morning. That doesn't mean that that would necessarily happen, because things can change. But we do have certain criteria. I don't know if Dr. Brink, again, if you want to add anything about in relation to, you've heard what Ewan has said, very fair question about relaxation of border controls and talk about movement beyond the island.
I think it is a very fair question, and it's a very difficult question to answer with absolute certainty at the moment. At the moment, we've got an internal and an external threat. So the internal threat is we know that we've had a second wave and we've still got viral activity on the island. Then we've got the external threat, which we can't control, which is the prevalence in areas around us. We've also got the added issue of the emergence of viral variants. I agree, we do need to have a conversation about the borders. I just think it's slightly too early at the moment. We need to get on top of our internal threat, open up, see what happens, and then look at what else we can do. So I think
There's so many facts in relation to what Sir John, keep borders closed a day longer than is necessary. We don't want to make Guernsey, Fortress Guernsey forever. People want to travel. They want to live their lives. They want to move beyond these shores, wonderful as these shores are. But we are appreciative, and that was a good question. Hamish Oscary, your question.
Yes, Hamish from ITV Channel. Just to follow up on this discussion, really, Deputy Brewer talked about people not wanting to lose hope, and people accept indicative timeframes and dates when it comes with caveats. So why are you not willing to follow with the UK government's model, with Jersey publishing their roadmap towards the end of next week? Why are you not willing to give us a sense of when the end of all restrictions may come with all the caveats in place? Because
it's just pointless. I mean, other jurisdictions must do what they believe is in the best interests of their jurisdictions. But we've seen other jurisdictions, I'm not necessarily referring to Jersey at all, I mean that, other jurisdictions have said things and then they've done a volte-face. We don't want to give people false hope. When we say something, we want to be able to be as confident as we reasonably can be that will be able to be achieved. Now, if I could say it today, Deputy Brewer could say it today, we would say it today. We really would be delighted to say it. But as I said to the previous questioner, and I say it again to you, this is something that we're looking at regularly and we will keep under early review. And the sooner we can give them a roadmap, to use the phrase that you use, and that's been used elsewhere, that's what we will do. Jim Delbridge.
Thank you, panel. Jim here from Island FM. My question, I believe, will be for Dr. Brink. We've heard that some people who've had the virus and then recover and then go on to have a vaccination, some people have a bad experience of that vaccination. Is this true? Something that you've experienced yourself, Dr. Brink, and can you shed a bit of light on this? Thank you.
So some people do have a bad reaction to the vaccination. They feel quite sick afterwards, aches, pains, headaches, and so on. So that's without a doubt. I think with regard to people who are vaccinated, who had the vaccine, I'm not aware of data showing that there's a huge excess of increase in side effects for people who previously had an infection. The reason why we recommend people who have had COVID before get vaccinated is that we're not sure about the duration of immunity to SARS-CoV-2, the virus that causes COVID-19. So I think it is worth getting vaccinated. But yes, people are getting side effects from the vaccine. However, these are short-lived. And some people have absolutely nothing. Some people will feel rough for 24, perhaps 48 hours. But we're not seeing anything beyond that. So I think that's really important.
Thank you. Aaron Capper, I don't see you've asked a question yet. It may be that you don't want to. I'll pass on to Juliet again. And if you do, I'll come back to you. Juliet, your second question, please.
Thank you. Last week, you gave a bit of an update that you'd said you'd had a relatively good response from people who were staying on the island currently but not ordinarily resident in terms of signing up so they might get the option to have a vaccination.
Yep. I
was wondering if you had any numbers for that and whether any of them were possibly started to be vaccinated if they were in the older category.
Thank you. I think Paul Whitfield had his hand up, if I saw correctly.
Yeah, Julia, we've had 198 applications or notifications from not ordinarily resident. And that seems to have plateaued out now. So whilst it's still open, the numbers seem to be staying around about 198, as I say. And now we're looking at obviously the categories they fall in, predominantly older age groups. But then we'll look how we administrate that and put that into our regime for vaccination in a safe way, in a way that we can obviously cope with the appointed distribution of vaccines that people have already been notified of.
Thank you. Aaron Carpenter, you've got a question. Aaron.
Thank you, Dave. One of the devastating effects of the pandemic, as you discussed earlier in the briefing, has been the impact on people's mental health as people experienced increased social isolation, financial hardship, and the wider ongoing struggle to come to terms with living through a global pandemic and what the future holds. Do the Presidents of Policy and Resources and Health and Social Care believe that the states need to invest not only in the island's economic recovery, but also into actions that will improve mental health provision in the island?
I'll come to Deputy Brewer because, of course, you're right, Aaron. It's both policy and resources. It's a state in general, but we'd look to our able colleagues in health and social care to give us some lead. Deputy Brewer.
Yeah, thank you very much. Thanks for the question. Yeah, we can always invest more into mental health and into all healthcare services. There is unmet demand around the world for services, but we have got some very good services over here. And just this morning, there are 3 services there that are freely available now. Our services are not overwhelmed. So please, if people do have concerns, please use the services that are there, all the way through from using your GPs. We've got secondary mental health care. That there is quite a lot of support there for people as we speak now. So please use that, and we will do whatever we can to support our teams who are out front looking after islanders.
I think, Aaron, you raise a general point. People now, and rightly so, are more conscious about mental health because in the past, many years ago, mental health was not an issue that was seen as high prominence. It rightly is now, and I can assure you that policy and resources and the states in general will give it high priority. I'm just saying, Hamish, your next question, please.
Thank you. Yes, Dr. Brink, you've often talked about the need for the data on the efficacy rate of the vaccine on cutting transmission. There was some very positive data coming out of Scotland this week that showed that the vaccines do cut transmission of COVID-19. Is that the data you've been waiting for, and is it likely to change the advice you are now giving to the political leaders here?
Absolutely. So the data on transmission is coming through. There's some vaccine-specific data on transmission, as well as some more general population-based data. There's aim of the program is to prevent morbidity and mortality associated with vaccination. But as this data becomes more apparent, it absolutely will be integrated into future phases of the vaccination program. So when you get to the under 50s, you can argue that COVID morbidity and mortality does not have the same impact as someone who's over 80. But if there's an impact on transmission, that program comes to the forefront in a much more prominent way. So I think the data on transmission is emerging, and I think even if it isn't a complete reduction in transmission, if it impacts and reduces transmission, that is still helpful when you're looking at population-based health and well-being. Now, we know that some people that had 2 doses of vaccine here both became infected, subsequently became infected with the virus. What is interesting is with the people that have become infected post-vaccination, most of them didn't transmit the virus further. And so that's interesting because it implies that they had low levels of virus. So that data is absolutely feeding into our thinking and will be pivotal in the future rollout of a vaccination program. And indeed, any considerations, for example, on travel passports, immunity passports, all of these, it'll be rolled into those considerations.
Thank you very much. Jim Delbridge, your question.
Thank you, panel. Policy and Resources has reviewed the business support measures, and you've announced that today. Some sectors will no longer be eligible for support, but others will. And I know you're also going to remove the recovery clause. What you're doing. I was wondering if somebody could just shed a little bit of light onto the thinking behind this decision, please.
Well, there's different strands going through. The finances, as Deputy Hellier described this morning, the end of the year were better than expected, but it's still a difficult road going forward. So we've got to balance the need to make sure that every penny that's spent is spent wisely, and every grant that's given is spent wisely. But against that, we recognise, for example, as I've said in relation to the payroll co-funding, that there are some businesses that need that further support. They'll get that. And that in the hospitality sector really is, whatever happens, whether it's July, August, whenever it is this year, if this year, and let's hope it is, they're still going to have a very difficult year. So that's been extended for another 12 months. And the recovery thing, I think that explains it. What I'd ask people to do is to look at the media releases, which went out, hour and a half, hour and 3/4 ago. Look at those again. And if they've got any questions, to take it up. Thank you very much again for that question, Jim. A very good question. I'm just looking. Juliet, your next question, please.
Yes, it's just in relation to the current stage 1 restrictions of allowing up to 5 people indoors in non-public facing role and up to 10 people outdoors.
Yep.
We've had a little bit of feedback from some of the local building firms who obviously operate on a number of different sized sites, some quite small sites, some quite large sites. They have said that they would prefer to see a system where it worked out how many people could fit on a site based on the size of the site, rather than just a blanket 10 people regardless of the size. Is this something that the panel has considered at all?
Yep. Well, I think all these things are under consideration. I mean, the main thing is, without getting too, I don't mean to be dismissive, getting too bogged down in relation to where we are and detailing the rules, to the finite degree that you would do in some kind of legal treatise, is to get out of these stages as quickly as possible. We're going to do that by minimising public contact and controlling this horrible virus. But it may be that Paul Whitfield wants to add something in that regard.
Yes, I think it is a really good question, and we've had an awful lot of dialogue with particularly construction industry representatives. We are very keen to keep working on with them, and we continue to work with them on how we might be able to accommodate them a little bit more going forward. But I just really want to emphasise, as we have done when we've been speaking to industry, in this first stage, stage 1, I think we mentioned this earlier on at a previous panel. It is a very light touch change to see how the virus might react to those easing of restrictions. And it wasn't solely based, although we're absolutely driven to open the economy up and get people back working and get normality back. This was a test just to see, with a little bit of opening up, what the reaction would be. It wasn't based solely on getting people to operate back into business. It was still a control on numbers. But actually, as been noted today, the success we seem to be enjoying and outlined by Dr. Brink will give us the opportunity to see how we may be able to accommodate, particularly, as I noted earlier on in today's session, over 400 different firms within construction have now notified us want to work. So we've got to listen and work with them going forward.
Thank you. Ewan Duncan.
Hi, my question is related on moving into stage 1, and it's comments from businesses really who were struggling to get answers from the states about what they could and couldn't do, and had to wait until the briefing, which is fair enough, but then they had to wait further for more information to come out, and they actually had customers or people who want to use their services telling them that they could now operate and this was the rules. But when they tried to engage with the states of Guernsey, they weren't getting anything back. They said they sent umpteen emails, but the main point is they just want to know how they can engage better in the future, how the states can maybe engage with them better when we move to stage 2.
Well, I know there were lots of emails. Certainly, I can only say personally, any email I've had, we've been replied to promptly, but I appreciate that's a general point. Paul, again, I think this is really a matter for you.
Yeah, I think it's always a good question. The information that's available online is exceptionally clear, and whether you're a business or it's more personal, you can usually find this section. It's a very easily notified tablets on that front screen as to where you go to. But I would say we're always keen to try and answer queries as quickly as we can. But we've only been in this 1 week, and we've had over 1,700 businesses notify. There's an awful lot of questions. We've got clinical health desks going. We've got general inquiry. We've got business support. And we're obviously running the normal services the island needs to run on a daily basis. And we're using the same people to do those jobs, but redistributing them in a different way. So, we will work hard, be patient with us, and we'll answer those queries. But I would say, as we always do, the information, when we make a decision, and I think someone's already mentioned, I think Juliet did mention about what stage 2 would look like. There's an awful lot of work. Once the CCA have had the right information and made their decision of what will open in stage 2 and what that will look like, then all the guidelines and the information and any changes to regulation have to be put in place. So the best port of call for the best and factual information is online, where that information is contained.
Thank you. Hamish, your question, please.
Thank you, and it's to you, Deputy Fairbrushe. Just to return to the support recovery clause being removed from the payroll co-funding, it's the latest in a few changes and climb downs on the original statement you made in a briefing calling for businesses to pay back support if they were found to have turned a profit this year. You say you've listened to the concerns of business and therefore changed your policy because of that. Do you regret not engaging with business before you made that comment in the briefing several weeks ago? And do you commit to speaking and consulting with business before any further changes are made?
Well, I don't see any climb down. I mean, you listen to people and you change things and circumstances change. It's easy for a journalist to pick up a pejorative phrase and throw it at a politician. But if the journalists listen, as I'm sure most of them do, and then go back over the facts and see the change in circumstances, then they can see why the decision has changed. So we have listened. What you can't do before you announce a decision is consult everybody. Otherwise, you'd never make the decision. So I believe that we've acted proactively and listened to people, and we'll continue to listen to people. Aaron Carpenter, your question, please.
One for Dr. Brink about it's been 3 months since Public Health introduced day 13 testing in order to pick up late presenting cases and also to build up some data about the characteristics of the virus. What have you learned since then about the presentation of the virus, and how has that informed public health decisions?
Yeah, that's a great question. So when we were thinking of day 13 testing, we were worried about people coming up late and us missing those people, and those people then being released into the community. Now, actually, if you look at how the variant virus is behaving, it appears to have a prolonged period of infectivity. So our day 13 testing is even more pivotal because of that prolonged period of infectivity. So when we looked at the increased transmissibility of the variant virus, the possibilities were it has a higher viral peak, so it has a greater viral load, so it's more infectious for that reason, or it attaches more avidly to the ACE2 receptors, which are the receptors that the virus attaches to, or it has a prolonged period of infectivity. And the final statement appears true. So we've learned that with regard to the virus mutating and so on, it is really important to have a conservative approach. And I think that's important. So that's important with the day 13 test. With travellers, we detected positives on day 13. Those would have otherwise been released infected into the community. So I think that policy has certainly provided protection for the island.
Thank you. Jim Delbridge. Jim, have you got your hand up?
Yeah, sorry about that. Yeah, I am here. My question was one I asked actually about right at the start of lockdown, and I wanted to ask it again to see if there's been a change. It's about physiotherapy. When will physiotherapists and practitioners who need to be hands-on with their patients, when will they be or likely to be available to operate again?
A good question. Chiropractic is the same. Doctor.
So all emergency physiotherapy is operational through the hospital and through the therapy group. So that's really important. However, getting back to more less urgent physiotherapy and other professions allied to medicine, really important. So we'll be looking at that in stage 2.
Thank you, Juliet. Your question.
Yes, I know that our public health professionals have been really good about checking research from all over the world about transmission and various of what's taking place elsewhere to see what we can learn from it. One of the slightly unusual characteristics of what's taken place in Guernsey is that, of course, we've all been wearing masks outside. I was just interested to try and find out what evidence has there been in possibly other places where they haven't had masks outside to possibly see transmission linked with it.
Okay.
And it could be something we can see change soon.
Yeah, we haven't all been wearing masks outside, but never mind. Dr. Brink, the question, I think you understand the thrust of the question.
Yeah, so the main focus on masks is for indoors, as you know, and we've always said outdoors, it's not legislated, and that if you're away from someone or if you're riding your bike by yourself, then you don't have to have a mask on. you're in your car by yourself, you don't have to have a mask on. It's all about that close contact with other people. And I think that's the fundamental public health principle that underpins mask wearing.
Thank you. Hamish, your question, please.
Thank you. Yes, Dr. Brink, if the vaccine rollout becomes an annual event and GPs are asked to administer it, I know in the past it said that the vaccine itself will never cost the individual, but will the state stop GPs from charging to administer it if the vaccine rollout continues year on year?
We haven't done that planning of a booster program. At the moment, we're not sure whether we're looking at an annual booster, a booster every second year. We're not sure how much the virus will mutate. I think it is very likely that we'll have some sort of boosting program, but we haven't scoped out exactly what that'll look like. We just want to vaccinate the whole population in the first instance.
Yeah, the only person I see, and I'm not seeking to dissuade or otherwise with their hand raised, is Juliet. So I'll come to Juliet. Your question.
Yes, I've been keeping an eye on the comments on Facebook, and one of the questions that came up, obviously I recognise there must be questions on this, but is someone set up visit someone as they're trying to keep the hospital clear of people as much as possible, but do we know when that might be possible in the future?
Are you able to deal with that, Dr. Brink, or would it be more for Dr. Raby?
It would be more for Dr. Raby, but it is something that we're discussing, visits to hospitals, visits to other areas. End-of-life visits and critical visits are, of course, facilitated through the hospital services. However, we've got to be very cognizant of the fact that we have vulnerable people in hospital and we want to do everything we can to protect them. So that is something that is under consideration at the moment.
Thank you. Jim, your question, please.
Yes, great news about SARC. My question is about Herm. Obviously, another small island, a very similar situation. What is the news for Herm? Have you got good news to deliver them as well?
Well, we hope we've got good news to deliver everybody, but the difference is, of course, I know Herm is difficult to get to in practical terms at the moment for obvious reasons, but SARC has got this 14-day, as has already got this 14-day. If you go into SARC, you've got to self-isolate for 14 days. Herm doesn't have that. Herm, although is a separate island, the rules are the same as Guernsey, and it is unlikely that those rules will change. But still, a very fair point, a very fair question. Hamish, your question, please.
Thank you. Dr. Brink, you have touched on this, but there was a question from a viewer asking about the unknown community cases that are still being found. How many of those are being, as a proportion, I mean, not in specific numbers, but how many of those are later being then linked with a contact or a known source? How many are you able to later down the line determine that they're not as worrying as they perhaps were initially?
So I think you've got to talk about the risk profile of detecting a symptomatic person in the community. So if we detect them symptomatic in the community, we won't change them to a contact link, because a contact by definition is someone that a case becomes a contact, or contact becomes someone who's in self-isolation, who we've tested because they're in self-isolation. So a couple of days ago, you'll see we had 4 cases, and 3 of which were contacts. Those people were in self-isolation, proactively tested. After 24 hours, our contact tracing process is so efficient that after 24 hours, it's unlikely that we'll find any further attribution of those cases. So, for example, the case that we had yesterday, by lunchtime yesterday, we were very clear that it was potentially linked to a source, but we couldn't directly link it to a specific contact. So by then we'd tested all the family members and so on, and we knew where we stood. So after 24 hours, we were unlikely to be finding any other direct links because we would have completed that work. So for example, if we take up a positive case at 8 o'clock this evening, hopefully we won't, but if we did, we start the contact tracing process straight away. We don't wait till the next day, wait sort of 10, 12 hours. We start that process within an hour of getting a positive result. And that's why we've been so efficient. So unlikely to get another attribution, but it is not reassuring, but it's slightly reassuring that it is linked to a source that we knew that there was COVID activity. So we could see a logical chain of logical sequence of events.
Thank you. Ewan Duncan, your question.
With SARC moving to phase 2 imminently, is it reasonable to assume that Alderney might move to stage 2 this week and Guernsey next week based on being a week apart? Or is there more to consider in Guernsey with the fact that we still have cases, whereas in SARC they've had none? And second part of that question, if we did move to stage 2 next week, what would that mean for schooling?
Yeah, good questions. You're right, there is a difference. We'll be discussing the situation in Alderney tomorrow at CCA, and it'll depend on the circumstances. And I'm not seeking to avoid the question, but we'll be discussing Alderney urgently tomorrow. They only have one case, as you know, that person thankfully is recovered, etc. Guernsey, it's still a little time off because we've got 60-odd thousand people. This is our third day in stage 1, but we will keep it under review. But we're going to be behind in time, SARC and Alderney. Jim. Oh, I'm sorry about schools. I didn't mean to put your schools. Schools, we've got the Education Authority representatives are coming. Well, they've been invited to CCA tomorrow. We'll have discussions tomorrow. And again, that is under consideration. Sorry, you and I didn't mean to miss that part of your very important part of your question. Jim.
Yes, panel. My final question today is good news about partners being allowed to go to antenatal scans, etc. How do the rules apply if you don't live with your partner and you're not in the same bubble? Thank you.
Yeah, good question. Dr. Brink.
If you don't live with your partner and you're not in the same bubble, because the person going into the scan will be in the scan room, they'll have the appropriate PPE on and they'll be socially distanced. So I think as long as you can sort out the transport up to the hospital, be socially distanced, I think it is not unreasonable under those circumstances for the partners to still attend. However, I need to have a big however there. This is up to Dr. Raby, so I would require his agreement on this. I don't want to turn.
Juliet, your question?
Just a quick positive question on vaccination. Obviously, we've been keeping at the same rate as the UK. And this week we had some rather exciting news from the Prime Minister, who says he's optimistic that everyone within the UK who wants to have a vaccination by the end of, I think, July should hopefully be able to have one. How exciting is that for our local vaccination team? And is it hopeful that we should also be at that stage if things keep going as they are?
Dr. Brink, I'll invite her in a minute, but of course it's exciting news. We're dependent on the UK for supply, as Dr. Brink's made on numerous occasions during these various briefings. We've got the capacity to do more, but we've only got so many vaccines. Do you want to add to that, Dr. Brink?
Other than absolutely, once we finish priority group 9, we would want to go out and roll out a population-based vaccination program. And I think with the increasing data coming out on transmissibility, that becomes even more relevant. So we'd like to do it. We'd like to do it as soon as we can. And we're looking forward to doing it. The vaccination team are up for it, and we're already looking at planning how we'd roll out a broader population-based program. So it's very much on our radar. And you're right, it's extremely encouraging news.
Thank you. Hamish, your question.
Thank you. It's a question from a member of the public. He's a father who has children in boarding school in England normally, not at the moment, of course, but now they've announced that schools will reopen from the 8th of March. And as I understand it, the quarantine period for boarding school children last year was reduced, I think, to 7 days. That was my understanding. Is there any suggestion that might happen again now that schools will be going back?
Dr. Brink, I think that because it is an important question. If the UK schools are going back in just over a week's time.
So no, they're not plans at the moment, but it is something that we'll constantly review. We have to consider what the prevalence of infection is, the prevalence of the variants, and consider what's happened to us over the last month or so. So really important, but is something we'll keep under review. We are cognizant of the fact that these are children, and we will keep it under review, but we don't have immediate plans to do that.
Thank you. I'm going to finish this session no later than 2, and it's about 6-7 minutes to 2. Juliet, you've got a question.
Just a quick question in relation to apps. Obviously, that's been a very popular way for people to keep track of infections, and obviously they're now using in the UK to keep track of people getting vaccinations. I think Jersey also has its own app. Is it something we've looked at having here or looking to have here in the future?
Dr. Brink? and or Paul and or Deputy Brewer. I don't know really. I know it's not me. Dr. Reid, do you want to say anything?
So the use of contact tracing apps we have looked at in a lot of detail, and I think from our perspective, it's what would it add in addition to what we've already got. So the area that I'm really keen on the use of apps is when travel comes back on board and people travel outside of Guernsey. And so if they're on a tube in London, that's really got a good functionality because that app can then ping. So that's really good. I think the use of apps worldwide has had a rather checkered response, with some people using them a lot, some areas using them a lot, people switching off their phones. From reports I've had, is some people that's pinging so often they just switch it off. So I think we'd have to be absolutely clear as to what we were using this app for. Our local contact tracing program has been extremely effective, not only in the first wave, but also in the second wave. With the vaccination program, we've had a community that has really engaged in that. We have a central repository of all the information of everyone who's been vaccinated, which is going to be really important if, for example, vaccination certificates, travel certificates come in the future. So again, we'd have to be saying what is the functionality of an app. So we'll continue looking at it, but we don't have any immediate plans to bring those in.
Okay. I see Paul and I'll just nodding affirmatively. Juliet, do you have another question?
I do, yes. Sorry to pummel the panel with questions.
Okay, but this will have to be the last one because we're coming up for 2.
I'll keep it short then.
Okay.
I've had a parent of a university student get in touch because, of course, universities in the UK aren't going back at the same pace as schools. And I believe currently the process is they're looking to hopefully make an announcement at around Easter with the hope that they might go back in early April. The concern we had was, of course, they're probably looking to get testing for students before they're allowed to go back. And the parent who got in touch with us was worried that they might have to obviously go to their GP and pay to have a test for their student to be able to return to the UK. What is the panel looking at in terms, if there does need to be student testing, how will that be facilitated, and will there possibly be a cost to students to be able to get that done?
Dr. Brink.
I think this is probably one for Paul Whitfield.
Fair enough.
If you don't mind.
We've worked you very hard today. Again, Paul.
Yeah, I think it's a good question, and as ever, I relate to the previous question about the apps. We are still a small population of only 63,000, and we do have limited funds, and we're spending a huge amount of money addressing this awful virus. So there will come a stage where we're going to look at the tipping point. That could be booster jabs, it could be whatever we need to do to live with COVID in the future, and see where it might be on travel, that people pay for vaccinations on travel. All those decisions, I think, as Deputy Furbrush as well as explained, they are being looked at. We might have made final decisions because we need to see what is happening with the universities, and how many are going back, when they're going back in relation to our regime. But we will plan it all. Or as that information comes in, it'll be fed in, the advice and the information will be provided to the CCA, and the CCA will be able to make the right decision informed on evidence, as we always say.
Again, I thank the media for their questions. I thank everybody for their attendance and my co-panelists for their excellent contributions. We'll have more information for you on Friday, and we'll see you on Friday. Thank you very much.